Greetings.
I have a granddaughter.
Mm-hmm.
Hello?
Hello.
Is having, since she was 7 months old, she had some blisters on her arms. My daughter took her to the doctor. They're like pustule-filled blisters.
Okay.
And they sent her to a dermatologist. They said it's called molluscum contagious.
Okay. Is it a virus? Did they say it was viral?
Yeah, it's a virus that it will go away by itself. She's 19 months old.
Well,
nothing's happened.
Here's a couple.
And then she started 2 weeks ago having like hives.
Okay.
Hives
every
night.
She's has all the signs of an activated immune system. The hives are a classic allergic reaction. The molluscum contagium, if it's a virus, that could also be immune in the sense that her body's not fighting the virus. So, do you know what your immune system is? Your defense system, how the body protects itself? Have you heard that term before? The immune system, Sylvia?
Yes, I know what the immune system is.
Okay, good. Okay, good. So you want to treat her hives and even perhaps the viral infection as a sign that the immune system is overworked. That means something is getting into the body, or your child's body, your grandchild's body, on a regular basis that's triggering the immune system, the defense system. And that almost always means foods. And with little kids, that's very common because of how we feed our kids. So what I'd be doing is I'd be trying to connect up digestive symptoms with specific foods and with the allergic reaction. So see if you can notice that she has problems with loose stools, constipation, bloating, gas, that kind of stuff. If she complains, or how old did you say she was? 19 months?
19 months.
So if she acts colicky, she acts kind of weird after she eats certain foods. She may not be able to tell you, but just kind of see if you can pay attention to digestive symptoms, and then see if you can attach those digestive symptoms to specific foods, then eliminate those foods. All right, that's step number one. Stop the immune system from being so active. Now, the hives are actually good because they're a very good diagnostic tool. When she breaks out in hives, that usually means that something within the last couple of hours or 3 or 4 or 5 hours got into her digestive system. Those are things that you need to eliminate. Secondly, you can strengthen the digestive system with nutritional supplements, and there's some real key ones for the skin, especially vitamin C. And the Beyond Tangy Tangerine is tailor-made for children because it tastes great. And don't have her drink the Beyond Tangy Tangerine all at once. Have her sip on it, and that'll get her a nice dose of vitamin C, which is very important for building the immune system. You'll get a little selenium in there, which is also very important for the immune system. See if you can get her to get some vitamin E also. Vitamin E is also helpful for the immune system. You probably want her to maybe taking 20 or 30 international units of vitamin E, a small dose. How much does she weigh?
23.
You know what? You'll get enough vitamin E in the Beyond Tangy Tangerine. The Beyond Tangy Tangerine's got everything you need, ma'am. But you want to treat it as an immune system issue, especially the hives and even perhaps the viral infection, which is basically a sign that the body's not able to fight off that virus. Sounds like she's got a compromised immune system secondary to an overactive immune system, and that's how I would be dealing with that. Skin issues are almost always a sign of an activated immune system. The skin is loaded, absolutely loaded with immune circulation, so-called lymph. Any kind of skin issue, first thing you want to think about is the immune system. For kids, for adults, for anybody. I'm talking about all skin issues, by the way, whether it's vitiligo, rosacea, acne. Look to the immune system. In fact, folks, any degenerative issues, look to the immune system. Look to the inflammatory system. If you're dealing with any kind of chronic breakdown disease, almost always lurking behind, you will find an activated immune system and an activated inflammation system. Basically the same idea, and it's very easy to deal with. Number one, all you got to do is remove the inflammatory triggers and the immune triggers. Number two, get yourself on a nutritional supplement program.
Hi, Ben.
Hey.
Yeah, I'm calling back about my daughter who had hives.
Okay. Have we talked to you? Did we talk to you in the past?
Yeah, on Tuesday. I was right at the end of the show.
Okay, so we didn't talk to you. I didn't tell you about the hives yet? I didn't tell you how to deal with hives. Hives is super easy to do. Hives is an allergic reaction, nothing more, nothing less. And that means something has gotten into the body that has sparked up the defensive response. An allergic reaction is a defensive response. Whenever there's a defensive response, logic just dictates you ask, what is the offending agent? And many of the things that we consider to be doctor-driven or doctor-mandated diseases, in other words, diseases we have to go to the doctor for. I don't think that's the right way of saying it, but if there's many of the things that we just consider we have to go to the dermatologist or the doctor for, nothing more than the body's way of attacking or defending itself from some kind of offending agent. The body's way of protecting itself, a protective mechanism. Hives are a protective mechanism. There's chemicals that are released into the blood when an offending agent has entered into the body. These chemicals, specifically something called histamine and other kinds of chemicals, some of them are these hormone substances that we're going to talk about here in a couple of days, but generally speaking, histamine is the main bad guy when it comes to hives. That's why if you go to the doctor, they'll give you an antihistamine. Right? Anytime you're getting
on now.
Right? Well, why are they giving him giving your baby an antihistamine? Well, obviously histamine is a problem, so they're giving you an antihistamine. Intelligence would ask, or would dictate, you'd say to yourself, well, why is histamine being produced? Well, histamine is only produced when the body feels like it's being attacked. So, what's the offending agent? Well, I can't tell you for sure, but you can figure it out, James. First of all, you want to look to when the hives, when they flare up, or when she gets the hives, and then figure out what did your daughter put into her system within an hour, half an hour. Usually hives are pretty quick. So a half hour, 2 hours, 3 hours before. That's it. It's as simple as that, James. And then, if the hives flare up, you want to say, well, what did she put in into the body when the hives flared up? Usually it's a food of some kind, almost always. Now, in addition to eliminating those foods, you can also use nutrition to help support the immune system and also help support the digestive system. Vitamin C is a natural antihistamine. It strengthens the immune system. She should be using vitamin C for sure. Zinc has pro-immunity properties, and kids are notoriously deficient in zinc, and they're burning through zinc quickly. Get her on the Beyond Tangy Tangerine, have her sipping on that. And I would also, how old is your daughter, by the way?
4 years old.
Okay, so have her sip on the Beyond Tangy Tangerine. That should be plenty of nutrition for her. If you want to throw something else in, maybe 5 milligrams to 10 milligrams of zinc a day. But she's going to get enough zinc in the Beyond Tangy Tangerine. So 2 things you want to focus on are foods, and then making sure she's using the Beyond Tangy Tangerine. Last thing, support digestive health. Chances are she does have a history of, and I'm not being psychic here. I'm just telling you, chances are she's got a history of digestive issues, constipation or bloating or complaints. Usually, sometimes it's hard with a 4-year-old kid to ascertain because they don't express themselves as well. But if she holds her belly, or if you notice bowel movement problems or anything like that, you want to assume that there's some digestive issues going on. In addition to removing problem foods, have her do one of the Biolumin Nightly Essence every day, and maybe get on some of those those Beyond Organic products from Jordan Rubin. Does she have a history of digestive distress? Do you know?
I would say so.
Okay, well, there's your culprit right there, my friend. And really, it's not, it's important for a couple of reasons that you get to the bottom of this. Number one, hives are miserable. That's really, especially for a 4-year-old kid. The poor kid doesn't deserve to have this. And secondly, she's running higher risks for autoimmune diseases later on down the road. She's running higher risks for inflammatory issues later on down the road. She's running higher risks for acne and other skin problems later on down the road. Correct digestive problems now, and you can prevent problems later on down the road. And that's really the most important thing. Okay?
So is there anything like to calm the immune system?
Yes. Keep the stuff out of the body that is... You don't want to calm the immune system. The immune system is her friend.
Oh, yeah.
It's defending her. What you want to do is remove the offending agent. And you can support the immune system, as I was saying, with vitamin C and some of the other nutrients in the BTT, the Beyond Tangy Tangerine. Have her sipping on that. 3 things to do. Number 1, sip on the BTT. Number 2, remove offending agents. Figure out the offending agents and then remove them. And number 3, support digestive health using the probiotics. You might want to give her a little bit of the Z-Radical also, which can support the digestive system.